Okay, hi everyone. I am Donnalyn from BSN 1C, and I am here to demonstrate to you all the assessment of the abdomen. Just like before, we should first have our hand hygiene. Next is must provide privacy for our patient. And we already checked the doctor's order regarding that procedure that we are going to do. First is introduce yourself to the patient. So, ma'am, I am Donnalyn, your student nurse for today. May I know your name?
Kisirin A. Barakyo,
And your birth date, ma'am?
January 29, 2003 po, and 3.
Okay, so, ma'am, may I ask, where do you live?
Mataas na Kahoy, Batangas po.
Who is the current Vice President of the Philippines?
Vice President, Sara Duterte.
Okay, we are asking this question so that we can know if the patient is conscious and in the right state of mind. So after asking the information from the patient, we should ask additional information regarding CSS. So have you eaten this morning?
Yes po.
When was your last meal?
Kanina pong 7 a.m.
Okay. And what did you eat last night?
Rice and chicken po.
Do you have any difficulty in moving your bowels?
Wala naman po.
Does anyone in your family have any cancer po?
Wala po.
Ma'am, do you experience any abdominal pain right now?
Wala naman po.
Okay, so thank you po. Then we should only expose the only area that we are going to assess, which is her abdomen. So before that, we should ask her permission if we can expose her abdomen. Ma'am, can we expose your abdomen po for a right moment because
Yes.
we're going to assess your abdomen po. So let me get my things and I'll get back to you and make sure when we come back, we should wear a clean glove. So after donning our gloves, we need to get our stethoscope and additional blanket to cover the area, which is this blanket, to cover the area that is not going to be expected to be seen. So first all, we must lift the patient gowns and expose only the abdomen of our patient. Before we do anything, observe first. Okay, I can see and observe a very small vision of the bottom of our patient. The color is the same as the rest of the body. It is not steady and the color does not show any discoloration like jaundice or cyanosis. After this, instead of the usual IAPP, we're going to do a IPPA, which is inspection, percussion, palpation, and auscultation. What we will do here is to inspect, auscultate, palpate, and percuss. After inspecting the patient's abdomen, now we will going to auscultate the abdominal part, which can assist on the 4 quadrants or the 9 regions of the abdomen. Okay, so this is the right iliac, right lumbar, right hypochondria, epigastric, and while this is the left hypochondriac, left lumbar, left iliac, left hypogastric, and umbilicus. Let's start with auscultation with the following parts. Okay, right iliac, followed by the right lumbar, right hypochondriac, epigastric, left hypochondria, left lumbar, left iliac, hypogastric, and lastly is the umbilicus. So what you will hear into this process is the peristaltic movement of our intestines, specifically the large intestine. So after the auscultation, we can proceed to our percussion. Then same parts lang din po. Right iliac, right lumbar, right hypochondria, epigastric, left hypochondria, left lumbar, left iliac, hypogastric, and lastly umbilicus. So after percussing, we can do now the palpation. It can be light or deep palpation. When we do our light palpation, the indentation should be at least 0.5 inches, and we will be using only one hand. Same parts lang sa abdomen, ang need ipalpate. Okay, so light palpation, right iliac, right lumbar, right hypochondria, epigastric, nakakaramdam ka po ba ng pain?
Hindi po.
Okay. Left hypochondria, left lumbar, left iliac, hypogastric, and then umbilicus. So next is deep palpation using our two hands. Okay. So ma'am, start na po ulit ako. Right iliac, right lumbar, right hypochondria, epigastric. Ma'am, nakakaramdam po ba kayo ng any pain?
Hindi po.
Left hypochondria, left lumbar, left iliac, hypogastric, and lastly, umbilicus. Any pain po, ma'am?
Wala po.
Ma'am, have you experienced anything when I did the palpation in the abdomen?
Wala po.
When you wanted to change sites in palpating, all you have to do is to ask the patient to move the right side or left side to be able to check the air in her abdomen. So ma'am, dito po sa kabila. Okay lang. Hanap na po. So we are all done in assessing the abdomen. We should cover our patient and disinfect the materials that I have used and dispose the gloves that I have used and do your hand washing or hand hygiene. Report to the attending physician any finding that you have on the assessment that I have done. And that's all for the assessment for the abdomen.